If anyone misses this session, you can feel free. We'll send out the link later and we can forward that on to additional folks. Special thank you to Vicki Clark and Brigida and the team at the Chamber for putting this call on today. It's a very timely and important issue, of course, and Vicki jumped right on it, and we have an all-star lineup today for bringing us the latest information on the vaccine. So thank you, Vicki, and a great job that the Chamber always does for us and the business community. All right, so before I turn it over to our speakers, just so everyone knows, there's a chat feature. Please feel free to use that. I will do my best to, after the introductions and presentation, moderate some questions to our presenters. So please feel free to use the chat, and Brigida will also help us along the way. So again, without further ado, we have a great lineup today. Joining us on the call, we have Vice Commissioner Len Desiderio. We also have Commissioner Will Morey. They are both co-chairs of the Countywide Recovery Initiative. We also have Acting County Administrator Kevin Lare. We have County Health Coordinator Kevin Thomas. And we have County COVID Liaison Mike Donohue. So I'm going to turn it over to start with Kevin Lare. Kevin?
Thanks, Doug, and thanks, Vicki and your staff for hosting us today. We hope to provide answers to any questions and all questions that you guys have. I can start by saying this: the Board of Commissioners has treated this vaccination process as the most important issue of our time, and they have done so by backing it up with the funding and every resource that we have available known to us, in an effort to set ambitious goals to vaccinate as many people as we can by Memorial Day. Now, that's very codependent on the state and the supply chain of first doses coming into the county. So I want to make that clear that we're wholly committed to this effort. We have, as you'll learn in this call, we have plans to open multiple sites, staffing plans, logistics. We need doses. So with that being said, our co-chairs of the Recovery Initiative, who you guys have all probably on one of these calls earlier in this COVID pandemic, we have Vice Chair Leonard Desiderio, and I'm going to ask him, turn it over to him, and then Len, I'm going to ask you to turn it to the other co-chair of the Recovery Initiative, Will Morey.
Thank you, Kevin. Thank you, and good morning, all. First of all, once again, I want to thank you all for the cooperation that you have given during this entire pandemic. As you know, this is something that we've never, ever had to deal with. But working with the business community and working with the Chamber in particular, we have been able to overcome some great obstacles. And the giving out of the vaccine is another obstacle, but it's something that we are going to do. And as Kevin said, the county commissioners, this is our number one priority, is to give the vaccine to as many people as we possibly can. So if the state gives us, more than we're getting at this time, we'll be able to give them out. As you know, the Avalon location is doing very well. It's going in an orderly fashion. We have to give kudos and thanks to the health department, and in particular, Kevin Thomas, for the job that they are doing. We're going to be working together. We're working together as one group to get the vaccines out. And safety and your health concerns are our number one concern. So we will be working together. And I just want to impress upon you that patience and cooperation, just like we had when the pandemic first started, was patience and cooperation was able to move us forward. That's going to be what's going to help us to move forward. And we're going to be working with you. And this will be the first of, I believe, many, many meetings that we'll have with you. We just need to have continued patience and cooperation as we move forward. And at this time, I'll turn it over to my co-chair, Commissioner Will Morey. Thank you.
Aha. the magic central unmute button. Thank you. Len, I think you covered really all bases. I'll just add my, I guess, sense of enthusiasm in this sort of sea of doubt that, in fact, the light at the end of the tunnel is not a train. Unfortunately, there is no playbook for this, as we've said before. There's no really opportunity to kind of practice. But one thing is for sure, we're determined in Cape May County to make certain that we are prepared to administer vaccines, and you'll hear that in the discussion today, that we will be prepared to issue a very significant number of vaccines. The information changes probably at least daily. And the team is really engaged with the state and any other resource that we can find value in to try to learn how we can increase the number of vaccines that we're able to deliver. And I think you'll hear that's one of the biggest themes right now is we're going to make sure we're prepared, but having the vaccines to administer is a key is a key effort and a bit of an obstacle at this point in time. So let me turn it back over to Kevin, or excuse me, to Kevin, and we'll dig into some of the information. Thank you.
Thanks, Bill. I'm going to turn it over to Mike Donohue. Many of you have dealt with Mike previously with the Recovery Initiative. Mike has stayed on as a consultant through this process as our COVID liaison. Mike, you're it.
All right, thanks, Kevin. Thanks, everybody, for being here. I'm sure there are a lot of questions, and there are some we can answer. There are some that we won't have adequate answers for because we don't have answers from the state, and the state doesn't have answers from the federal government. So we are stressing patience. Clearly, that's been a theme already. But, if we go back to what seems like a million years ago last spring, when the Recovery Initiative came together, the Cape May County-wide Recovery Initiative, with all of you in the business community, with the healthcare sector, with every mayor in Cape May County, the entire board of what are now the county commissioners, pulled all that together to figure out how to put a proposal together to the governor to open Cape May County up so we could save the summer of 2020. It was a huge task, and it took a great deal of effort and patience then. And I will tell you that this is a bigger task. This is a monumentally bigger task, something that's never been done before, the greatest public health challenge in living memory. And Cape May County is doing very well. Our Department of Health under Kevin Thomas has administered the doses that we've gotten in terms of per capita rate at the highest rate in the state of New Jersey. So we are doing everything we possibly can to move doses into our residents. The operation in Avalon at the community hall has run very efficiently. People we've sort of surveyed coming out of there, universally positive experience. We have another site coming online. We will have it set up within the next week or so in the southern end of the county, and we're looking at a site as well in the northern end. But we can't get too far ahead of ourselves, and I'm going to dig into the meat of this for you. We have been getting approximately 500 doses, first doses a week. Now, second doses are a different batch for people who've already had the first dose, obviously, and there's a little more than 3 weeks, 4 weeks close to that they have to wait to get the second dose. The big thing is the first dose. That's what everybody wants. We've been getting a limited number of that, and we were informed yesterday that that number may go down slightly, but it should not fall below 400 a week. We have the ability to do that in about a day. So you see the challenge. Thousands of people are registered and ready to get the vaccine. We can only give out what we have. Now, to touch a little bit on the process the state has set up. You register with the state. We're driving people either to the state website or capemaycountynj.gov, where there's also a link to the state registration. Confusion starts right there. People believe that registration means an appointment for a shot. It doesn't. Registration simply gets you into the system so that when the time comes for the state to consider you eligible, you'll get another email. Eligibility does not mean you have an appointment. So we all have learned that in the last, 24, 48 hours. People are getting these emails that say, congratulations, you are eligible for the vaccine, but we don't have an appointment for you. And the email itself is confusing internally. It says you can check out these locations. When you get that email, you're eligible, but you will get another email to schedule an appointment. Very confusing. What we said back in May during the recovery initiative is the one thing we have no shortage of is confusion. But we are trying, to do things like this to try to keep people up to date. You will, at some point, hopefully soon, if you're registered in the state system and you've been determined to be eligible, get an email that says, okay, now you can schedule your appointment. But that's extremely challenging as well, because an appointment has to be tied to a dose of vaccine. We cannot schedule an appointment without a dose to give you. So if we're only getting 400 doses a week, you see the challenge there when we have thousands of people registered. Now, the state is telling us that they don't know from the federal government when they will get a larger supply. And they're consequently telling us they can't tell Cape May County when Cape May County will get a larger supply. It's where this call for patience comes in. We really have no choice. It's very frustrating, but we are asking everybody in the business community and beyond to remain patient. It's something I think all of us kind of have a shortage of after all this time, but we really don't have a choice except to remain patient. We're doing everything we possibly can to get every dose we have into someone's arm as quickly as possible, but we can only do the number of doses we have. So more information is coming, hopefully, from the state. We see the day now when we can get past COVID, because the vaccine is made, it's coming. The federal government is continuing to push it out. Other companies are bringing it online. Johnson & Johnson has a one that's more stable, doesn't have to be frozen, and is a one shot instead of two. That's all good news, all great, very positive news. And the day is coming. It's in this interim time as they figure out these supply chains and distribution efforts that we all are going to be very frustrated. So we have called upon the business community throughout these efforts to help us from the county to make sure everybody sort of understands it's coming. It's like when we developed, right, all these protocols for all of our businesses, mitigation protocols to get open under COVID, and sent it to the governor, and then we had to wait, right? And we had to hang on to that some reserve of patience as the governor said, okay, that date will work, and we can partially open that thing. And we find ourselves here again. And the race is on again, as we all know, to now save the summer of 2021. And we're going to get these doses out as they come in as quickly as possible. And our expectation is that over the course of the next several weeks, federal government will send more to New Jersey. New Jersey will distribute more to us. That may be 3 weeks, 4 weeks, we don't know, but we're hopeful it's within 4 to 6 weeks we start seeing better numbers in terms of doses coming here. Could be sooner, but we don't want to be overly optimistic or over promise in terms of when we'll have more doses. We've been told we'll have a minimum of 400 first doses to get people that first dose each week. Now, in terms of making an appointment in Avalon, again, 400 doses, 400 appointments. So those will open and close very quickly. People will get emails and say, go make an appointment, may discover that it's full. And that's just how it's going to go for a while. As soon as we have the doses to use, we'll open other sites and start doing it. Our goal is to get to 1,000 a day as soon as we can. But with only 400 coming to us per week, we obviously can't get there yet. So again, no shortage of confusion. I think hopefully things will stabilize shortly. Last thing I'd say is the Atlantic City mega site is opening today, I believe, but they're booked. They're indicating they may have appointments opening up again January 26th. But you want to go and Google Atlantic City Mega Site and Atlantic Care, because they appear to have a standalone website that you want to check out. That is not something within the control of the Cape May County Department of Health. That is the state and Atlantic Care with the mega site in Atlantic City. And I would assume that some of our residents would go there and get a shot if they could. So everybody should, you know, just put in, I think the site is actually vaccination.atlanticcare.org. But again, that's not our site. We don't control that. We don't control how they operate or how the state or Atlantic Care handles those appointments. With that, I'm going to ask our director of the Department of Health, Kevin Thomas, who is, you know, I want to give a shout out to him and his nursing staff, especially the work that they have done throughout COVID. They were the people responsible for tracking the pandemic, for doing contact tracing, all the things you've heard about over the course of the last year almost, they've been responsible for. And now they have shifted to this gargantuan task of getting, you know, hopefully 70,000 people or so inoculated between now and Memorial Day. It may be a little ambitious, but that's what we're trying to do. But we need doses to do that. So Kevin can tell you what the state has done to this point, what Cape May County has done to this point, and fill in those specific blanks that I've left out. All right, thank you, Kevin.
All right, thank you, Mike. I appreciate the chamber and inviting me on this conference call. And I know I see a lot of questions popping up in the chat box. I'll try to hit some of those in my discussion here. One thing I must say is the chain of vaccine is flowing into Cape May County. That's the best news, and it did happen at the end of December. We were requested by the state to help them with doing the medical people initially, vaccinating medical people in Cape May County, including the doctor's offices, pharmacists. We were involved with the dentists and any other type of healthcare you can think of. The hospital received their own shipment of vaccine. The hospital received Pfizer. The health department receives Moderna. Okay. The other part of this is vaccine is flowing into the long-term care facilities, which is our most vulnerable population. So, you know, I am relieved to see that they're all starting to get their second dose in the long-term care facilities. That again is I believe it's the Pfizer type of vaccine, and that is being administered by their local pharmacies here with CVS and the Walgreens. So they're working on their second dose right now, both staff and residents in those facilities. So one thing about that I will say is that once they are complete within those facilities, that will help to free up a lot of other doses that come in to the state of New Jersey. The numbers that I saw this morning about the state of New Jersey is that total vaccination that has been done, both first and second doses, was 475,000. I mean, it's good news. We all want to see more doses coming into the state of New Jersey, and we definitely want to see, you know, needles in the arm in Cape May County, especially. I know everybody's anxious, and once we at the health department want to get that done too. The more doses I get, the more doses I can get out there into the community. One other point I want to make is that we at the health department will not be alone in this endeavor. You'll have eventually all the pharmacies opening up with vaccine. You're going to have your doctor's offices. You're going to have the urgent cares and the complete care, which is the federally qualified health center, opening up with vaccine. So there would be help along the way. It won't be just the burden of the health department, but you know, we're ready to receive the bulk of that burden and make sure that those doses are out there. I mean, we're up and running since December, and the way we put the information out there, and mainly through the media, We put press releases out. Mike Donohue orchestrates those press releases along with some other people, professionals we have here at the county government. And they go out mainly and they're picked up by the Herald mostly. So our initial rollout of the vaccination came out through those press releases to the Herald, and they were listed for a number to call in and get registered. And we've been using that registration process through the health department up to and including last week. However, Monday was a mix of those registrations, but we went to the state website. So the state website, as far NJVSS, which is the COVID website that you can get. I know it's been a little frustrating, but that's the website that everybody's been going to, and it's covidvaccine.nj.gov to register for your vaccine. And with that registration, it made the process smoother with the health department and with moving the line quicker. I know it might not make the process with you right now quicker because there's anxiety there. I mean, my telephone rings off the hook as well as everybody else's telephone here in the health department with, hey, I am eligible. Of course, you're going to get an email that says, I am eligible, but there should be, the state should emphasize, because it's a state website, they should emphasize you're going to get another email. And the other email says, look, a slot has opened up. Go in now, look for a registration, a time slot, go in and register then. Then you get an email saying, all right, you're registered, here's your time slot. So the confusion lies where it says I'm eligible, and then they start calling the health department, oh, I'm eligible. No, you got to wait for the second email that comes from the state site and says, all right, go back in, look for your appointment. So then you pick your appointment and then you're ready to go. Of course, that's frustrating because it's a, well, when am I going to get that? That's the other part, is a question mark because of the amount of doses I'm getting. So I'll tell you that to date, as of yesterday, the health department has given out 3,387 doses. Some of those are second doses, which only started this week. So second doses are, it's going to be a combination from now on of second doses and first doses. And the numbers that I get is roughly, I've been getting 1,000 doses per week. And I'm going to be getting enough doses for my second doses. And unfortunately, I only will be getting 400 to 500 for my initial first doses for the entire week, which is very frustrating on my part because I'm ready to do at least 3. Actually, we did like, and I said, let's see, yesterday I did 325 in a day. Before that, I did 380 in one day. So I'm ready to do up to 500 at one single site per day if I have the doses. Again, I don't have those doses. I've been advocating, the politicians here, the government's been advocating for those doses, and it's just not coming to any county. You might say it's Cape May County. It's not any county, it's all counties. I mean, Cumberland's only open for 2 days for their site. They're getting like 200 to 400 doses. Atlantic County initially with their health department site was only getting 1,000 doses a week. So on your part, it's frustrating. On my part, it's frustrating. But the good part about this is we're ready to go. Whatever comes in, we're putting in the arm. We're ready to go. There's nothing sitting on the shelf. We're making sure that people get their doses, and we're willing and able to give those doses when they come down the pipe. So I must say that it's, you're anxious. I understand that. There's a couple questions there that should be answered that I've been getting is that, well, what if I don't have a computer? Of course, everybody on this line might have a computer or they might have a cell phone. So the state has actually given out us a nice phone number that you can talk to a person one-on-one starting Monday, I believe, this Monday, and they'll help you register on the state site. So that number is 855, and I will put it in the chat box when I'm done, 855-568-0545. So that's 855-568-0545. And all this information, how to register, and these numbers are on the Cape May government's website. So you can go there, Cape May County Gov, or Google that. You'll be right there on the website, and you just click on registration for the state vaccination registration. That's on there. These numbers, the one I just gave you is on there, and also any type of press release that comes out, which gives you our daily positives, not just, vaccine information, but it also gives you the positive numbers in Cape May County to date. And I mean, I could give you that number now. It's 5,499 positive cases that we've had this year. Keep in mind, we're one of the lowest positive rates in the entire state. So, I mean, and I thank the government, the local governments, and all the people who will listen to the statements of social distancing and masking and making sure you're doing the right thing to keep yourself safe. So that's the important thing, and I think Cape May County has done a fairly decent job of doing that and keeping people.
Yeah. Hey, Kevin, can I jump in on some of those questions?
Jump right in. Go ahead.
Yeah. Look, I think, some folks understandably were hoping to come on this Zoom meeting and get an answer to when they can schedule an appointment. We don't control that. The state has you register with the state, like we talked about at the top. You get an email that says, okay, you're eligible, and you're going to get another email that says, now you can schedule. Very frustrating. The eligibility email, which I've seen, is internally confusing. I'm not casting dispersions on anybody at the state. This is all very challenging. But it's, the first paragraph says you're eligible and wait to get an email to schedule your appointment. The next paragraph says you might be able to schedule an appointment at one of these sites. You click on the link for a site, takes you to a couple of ShopRites in the Department of Health. The ShopRites are out of our control. They're doing what they can as well. They, from what we understand, are booked solid. They have very limited doses also. The Board of Health is not a vaccination location, but they are doing all they can to answer your questions. The number that Kevin just gave out, the state is opening up, I believe, on Monday, which should be able to answer questions and help people as well. We are standing up a small call center for the Department of Health to help field those calls. And essentially the answers you will get are what we're talking about here, that you need to register at the state site. You can find a link to that at capemaycountynj.gov. You register there. At some point, you get an email that says you're eligible. After that, you get an email that says schedule your appointment. Now, the question has been asked whether you have to schedule in Cape May County. It appears that people are scheduling from outside and coming here, and people are scheduling from here and going somewhere else. But again, that's completely within the control of the state in terms of what they open up to you when you get that email to schedule an appointment. So these are not satisfactory answers to us. I'm certain they are not satisfactory answers to you, but those are the facts as they exist at the moment. Another good question is there a plan to vaccinate our elderly residents who do not have computers and many are homebound? Kevin touched on that a little bit. Our social services department, our fare free transportation department are all already engaged. Fare free is already providing transportation to the vaccination site for people who use that transportation, who are some of the most vulnerable people we have. The Department of Social Services has lists and contacts for people who are shut-ins, non-ambulatory, who need services such as that. We also have an RV that's a mobile testing RV that we are giving consideration to and probably will convert at some point to a mobile vaccine unit in a very limited capacity for those people who are absolute shut-ins in order to get the vaccine out to them. So we are focused, have a lot of focus on those vulnerable populations and how to get the vaccine to them. So there's a consistent question. Once you are eligible, how do you schedule your appointment? The answer to that is you will get another email from the state at some point. And again, an appointment is tied to a dose of vaccine. So an appointment without a dose is not worth anything, and we can't schedule, they won't schedule one without a dose. Again, 400 doses essentially per week with thousands of people registered. This is going to take some time to get everybody an appointment. There was another question I saw. Just give me 1 second.
Mike, there's a question about priority. Could you address that a bit if you can?
Yeah, priority again has been set by the state, phase 1A, phase 1B, which is essentially started with those frontline workers, healthcare workers, people of high risk. But in the middle of that, again, this has been, it's the way this kind of thing goes, I guess. We've never done this before. They did this sort of blanket open to 65 and older and people with certain conditions. There's a whole list of conditions that the state put out. You can find it on their website. And that really broadened the group of people who will become eligible for the vaccine. However, there's no vaccine for them, a very limited supply of vaccine for them. So essentially, if you're 65 or older, you have pre-existing condition, anything from, COPD to, a body mass index of 36 or over and everything in between, then you become an eligible person. That doesn't get you an appointment. So the frustration for everyone here is clearly getting that appointment. And it has to be tied to a dose, as I said. So we will move through this. The people will get, in order of the priority set by the state, an email that says, go make your appointment. They will show up, Avalon Community Hall. Something we should note, you cannot show up there and walk in. You can't show up and say, I fit the criteria. I got my eligibility email. I want my dose. You won't have an appointment when you get there. And the people who have appointments are the people who are scheduled for that day. Very frustrating. I've witnessed it myself. I feel terrible for those people who have to be turned away. But every person going in that door has an appointment, and that's how it works. It's very challenging. So again, one of the things we wanted to touch on and ask you all to consider as we move forward is we will at some point in all likelihood be able to have some evening hours, Saturday hours. We're not there yet. We don't have the doses really, but we're asking you all to consider allowing your employees during the workday to be able to schedule an appointment once they are capable of doing that the state notifies them, that you allow them to schedule during business hours. I know it will be a challenge. I know you don't want to, lose employees for, an hour or more in the middle of the day, but it would be of great assistance to all of us. And we believe we would be able to get through our county population more quickly if employers considered allowing their employees to leave work to go get the vaccination. So we just ask you to consider that as we move forward.
I want to jump into a couple questions that I see on the chat. The doses that come to the county are like ShopRite gets their own line of doses. Nothing comes into the Cape May County to the health department and then gets shipped out to anybody else. We only take care of whatever doses that we get. We don't give them to the nursing homes. They get their supply from CVS, who gets a supply from the state. The state gives me individual supply to the Cape May County Health Department. So I am not managing doses at my level. I'm only managing them for what I get to the people that I'm going to give it to. That's it. As far as the state goes and how they manage the doses, that's above me, so I can't answer that question.
How about the question of do you need any volunteers? Would that help?
I believe on the Cape May County government site, there's I believe that there is a volunteer button, and it goes to the Medical Reserve Corps. You don't have to be totally medical to sign up for that. And there, you know, because we have different types of positions as far as runners go, and as far as cleaning down chairs and helping with the food and so on and so forth. Those are other positions that are open to non-medical, but we certainly encourage those who are medical to go to the Medical Reserve Corps site, which I believe there is a button on our site to help them register. Mike, I haven't been there lately. Is that up and running? Do you know?
It
I
is.
was told that it was.
It is running.
Okay, so yes, that is working.
There's a live link on the county home webpage, which we had made our COVID. When you Google kmaycounty.gov, you will open up to our county homepage, and it is all COVID. And there's a link there to register if you would like to volunteer. If we have doses that help us meet our goal, which is 1,000 a day, we will need volunteers. It'll take between 30 and 35 people to operate a site inside the building. And it'll also take another 10 to 12 people outside the building directing foot traffic. The county obviously would embrace people that would like to volunteer. However, the commissioners, the medical staff, we are contracted. We have the funds to make it all happen, but we will absolutely embrace anybody that would like to volunteer. We're not there yet, but we're hopeful once the vaccines come in plentiful supply that we will be calling on people that have volunteered.
Yeah, and we've, we have a number of volunteer medical professionals who have been engaged throughout, and we continue to have some RNs and others who are asking about volunteering, and the Department of Health is keeping that information on hand. And our hope is that we will need all those people, that we will get to the point where we're running several sites and we can give folks a break and bring in some of those volunteers and be continuing the effort. As it stands now, the Department of Health's resources are more than adequate for the Avalon operation. And but certainly there's been, and it's a testament to our community, an interest in volunteering, and God willing, at some point very soon, we'll have a need for that in terms of we have a few already. We have some EMTs on hand. We have some other folks who have been trying to helping to direct people. You need to go here, you go here next, that kind of thing. It's been very effective. There have been a couple questions about how to get to the state registration. We have a big pink button at the homepage of Cape May County government, which is capemaycountynj.gov, and you can go there. You can also go what Kevin just posted in the chat, which is covidvaccine.nj.gov. Both of those will take you to the state registration, which is the beginning of the process. Again, in terms of getting that email that allows you to schedule an appointment, it's up to the state. Very frustrating. When you get that email that says you're eligible, that's not your appointment. And in all likelihood, you won't be able to make an appointment at that point in time. So, the good news is there is vaccine coming. The good news is we've vaccinated already about 3,000 or so Cape May County folks. And we're beginning down the path. It's the old Winston Churchill quote, this may not be the beginning of the end, but it's certainly the end of the beginning. And we are beginning down the path now to vaccinate and get to that point where we can really start to see the day we put COVID behind us. Very frustrating, I know. We appreciate all your patience. Patience, as I said, is the theme of the day. And we'll continue to push. And as Kevin Thomas said, there are a lot of people advocating for more vaccine. Elected officials, business community leaders, health community leaders who are advocating with the state to send us more vaccine. And the state's answer is a reasonable one. We don't have it, we can't send it. So we're waiting then for that major federal undertaking they're doing about 1 million doses a day around the country. But again, this is supply chain. This is coming from different companies. So you go all the way back through that supply chain. The company has to produce it in mass quantities. They have to get that to the federal government. The federal government has to get that around the country. Each state has to get it out to a county. It's a huge, massive undertaking. I think we should be grateful. I am, after with everything that we do every day, that we have some vaccine, that we have some that's going out, because we could just as well be in a position where we have none. So those 400 doses, 500 first doses each week are going to go in the arms of 400 or 500 people, and second doses will be going as well. So again, these aren't adequate answers to a lot of these questions, but just to recap, go and register. Cape May County NJ.gov or covidvaccine.nj.gov. Register. Get your eligibility email. Wait for your scheduling email. That's what we have to do. It's all we really can do. And we are moving people through. So the system on some level is working because we are getting rid of every dose we have in a very efficient manner. That's frustrating, I know. And we all have loved ones that we know are eminently qualified that we want to get over there and get vaccinated. And it's very frustrating, but we could do only what we could do. We're moving those doses as quickly as we can. And we all just need to pray that the supply ramps up very quickly. And, a couple of weeks from now or so, we're sitting here with, 2 or more sites going every day with hundreds of doses.
Mike, just a couple questions we're getting from the chat. The appointment process. So
Yeah.
Once you get that email to schedule an appointment, how does that work? How's the location selected?
To be honest with you, Doug, I haven't gotten that email and I haven't been able to track down one of those emails, but my understanding is that you get that email that says you can schedule a location and there's a link and there are locations to choose from. What that looks like precisely, I can't tell you, but people I've talked to, because I've asked that question to people who've gone through that process, that's how they describe it. So my assumption is that they're coming up with the Avalon location because that's the only site we have open right now. It may be that there's a geographical or maybe the whole state and you can pick, but I haven't seen that. I've been trying to get somebody to forward that to me. I've been unsuccessful so far because they're told, from what I understand, this is personal to you. You can't, if you send it to somebody else, they can't make an appointment off of
So
that
that
email.
might be part of the same question, but as far as scheduling the second dose, what does that look like?
So the second dose, Kevin, you can probably talk better to that, but ideally the second dose is scheduled when you get your first dose. Kevin Thomas, what do you think?
Well, the state software, again, is requiring you to go back in once you are notified there's a, it's going to be the same as the first time. It's going to tell you to go back in and make an appointment. They'll send you an email. It's time to make an appointment for your second dose. It's going to be, they're trying to nail it down so that you'll get your second appointment when you after you get vaccinated. So we asked the state to do that with their software, and hopefully that will come Monday, because I realize that's a glitch that's going to make everybody crazy, not just me, but everybody else. And hopefully they'll have that fixed by Monday, whereby you got your first dose. As soon as you get administered, you'll be registered for your second dose time and date, and we'll call it a day. That way there's no ifs, ands, or buts about the situation. But this week might run into a little snafu with the state scheduling software, but we're working through that.
Right. Somebody asked about the 1C group. So we, as the county, do not have the ability to open groups to eligibility. That's going to come from Trenton with guidance from the Centers for Disease Control. So if you're in 1C, we can't tell you when they will open that group. It will be up to those folks who make those decisions, and we'll know all probably around the same time. Hopefully it will be soon. But again, there's a large group of people to get through, and understand it's in our interests to get through those folks, because the more high risk folks we have vaccinated, the more likely we are to take pressure off of our healthcare facilities, which, you know, makes this pandemic much more manageable.
There's some discussion about there being unused or excess vaccinations available at the state level. I guess my question would be the 4 to 6 week time frame for this ramping up. What indication are you receiving from the state as far as that goes?
Well, listen, there's really no solid indication, but listening to, you know, we're on these calls and talk to them. They had a Cape May County specific one yesterday, that they expect us to be at this 400 dose per week level into the beginning of February, first couple of weeks of February, when they're hope to be in a position to reassess. So I'm just extrapolating sort of from that information. And it's a hope really that that's the time frame. It kind of is a sense that there's an expectation that 4 to 6 weeks, they figure out some kinks on the federal level and they have more of a flow. What that amounts to, if we go from 400 to 500, from 500 to 1,000 a week, you can't say. So, but I don't want everybody to have the impression that we're never getting more. I also don't want everybody to have the impression that it's coming tomorrow. So hopefully within a month or so, we have a greater supply. What that looks like, we don't know. But again, we're ready to go. The Department of Health, so we have a county COVID working group internally that Kevin Lare, the new acting administrator, put together, that consists of probably 10 or 12 county departments in support of the Department of Health. So you have IT and Office of Emergency Management, Fair Free Transportation, Social Services, HR, legal. All of that is together. We've identified precisely what we need for a vaccine location: staffing, tables, chairs, bottles of water. We have this all nailed down and ready to go. So as soon as the doses come, the doors are open and everybody's going through. That doesn't do anything for people who want the vaccine today. Understand that and don't have an appointment. But again, we can only give out the doses we have, but understand we are ready to go. This thing is going to ramp up as soon as we get doses, the doors are going to open, more appointments will open up, and we'll move through as many people as we can. So again, the theme again, patience, and it's very hard. It's something I think after this length of time in this COVID era, we all kind of have a small reserve of, if any, but we got to kind of dig into it. It's hard to ask you all to do that, but that's the only thing that's going to get us through this. And you know, we understand, as you know, from the efforts we all put in the recovery initiative in the spring, and that was all hands on deck. And I see, as I look around the folks in this call, many people who were very much involved in that, what it takes to keep our economy going here. And this is another effort. We have to, as soon as we have these doses, be in a position to get through as many people as we can before we get to the summertime. And we are prepared to do it right now. So God willing, as I said, we all need to pray that this spigot opens and the doses start coming, you know, in greater and greater numbers over the course of the next several weeks.
I appreciate that. I think we've gone through all the chat questions. If there's anything else anyone wants to get in there, please do that now. I would ask of our presenters, any final thoughts?
Oh, we're presenters, Doug. I'm sorry.
Presenters, sorry, our illustrious panel.
I think you heard enough from me.
Yeah. No, we seriously though, we all appreciate this. I know we have a lot of folks on the call. Again, reminder, we recorded this, so we will send this out. I think a ton of good information. I have a lot of notes, phone numbers, statistics, websites, all very much appreciated. He clarified a lot of questions folks have. And if no one has anything else to add at this time, and Will, let me unmute you.
So I think, as Mike and others have mentioned, this is an evolving and changing environment. And it could very well be that we have additional information as early as Monday. So I know we've talked about circling back as needed for additional calls. Mike, I'm not certain if we have set up on the site sort of a frequently asked questions that we're updating. That may be and sharing with the chamber.
Oh, you know what, Will?
Yeah.
I'm really glad you went there, because we have modified. We've made the landing page of the Cape May County NJ.gov information about vaccination, so it's right there. You don't really have to go look for it. You may have to scroll down a little bit, what have you. A couple of things we are bringing online shortly. We have radio going kind of with the message we're talking about today. We will have TV going shortly. We had our Finish Strong, Safely Together messaging through the holidays, which I think helped us avoid a real major, post-holiday bump in cases. We're switching to Vaccinate Safely Together. That message is being driven now and will be pretty heavy. We also are in the process of bringing on a vendor for text messaging that will, essentially go to everybody in the county who has a cell phone. You can opt out if you want. We also are looking into, and we'll probably purchase as part of that what's called geofencing, so that if you drive into the county, you get a text message that says, for COVID vaccine information, et cetera, go here. All that's coming together. Look, part of what we didn't anticipate was that we wouldn't have the vaccine doses we want. Part of what we didn't anticipate was that the process for registering, becoming eligible, getting an appointment would be quite so convoluted and confusing. But we got to just plow through that. So there's a whole lot of communication coming, methods for outreach coming. And yes, we will be updating the homepage as we have information at Cape May County NJ.gov. So, check back there. You can get to the registration there, and we'll keep putting information out there. We will ask to the chamber, or the chamber can certainly come and ask us for another one of these types of meetings at any time. And certainly when we have material relevant information, we're going to ask to get you all together again and provide that to you. Okay.
Yeah, I think that, this is obviously, we need to move at the speed of business, right? And I know government is really, working hard to do that. But I do think I see a real effort to, to work out this Rubik's Cube of that we sort of have before us. And day by day, you guys are, I think, gaining more information and can provide more information. So I just want to make sure we have a really fluid and efficient system of getting that information out. Because as you said, Mike, folks are really uneasy. I think your words about patience are really, really important. I'm thankful there is a vaccine. We're beyond the point of hoping there's a vaccine. There is one. And, I think we're all trying to work together to, as you say, get it in arms as quickly as we can. As we get more information on the mega site, there may be some opportunity there from Atlantic County. We're going to dig into that a little bit more as well. But, unfortunately, there's a lot of folks trying to figure out this. The state's trying to figure this out. So, there's a lot of figuring out going on. Obviously, leadership change in Washington that's going to bring about some additional changes. So I think this is going to be a really fluid environment over the next week. And it sounds like we're poised to be able to get information out promptly.
Thank you.
But
Yeah.
before we close, I just wanted to mention that there was a question in the chat about saving the chat questions. We'll include that with the recording. It will be hard to read because it comes up very small when it's saved. But, I think there was some information, really good information that Kevin Thomas provided that people may want to refer back to. But just so everybody knows, it may be a little hard to read, but we will provide it.
We may be able to build that into those frequently asked questions component as well. So,
okay.
That'd be great. Okay, well, thank you, everyone. Thank you, especially to our presenters. A lot of hard work, a lot of endless hours, I'm sure. Thank you to our chamber team for putting this call on. Please continue to forward any questions, and obviously the county's very engaged here. So Appreciate and have a safe and healthy weekend. Thank you, everyone.
Thank you.